In swimming pools, the free residual chlorine required for providing adequate protection against bacterial and viral agent should be 1 mg per liter. Which of the following will be target population for screening of diabetes? Women who have had a baby weighing more than 4.5 kg, people over 40 years of age, people with family history of diabetes. With reference to Indian man who can be categorized to be carrying out moderate work, what is the recommended dietary allowance RDA of thiamine in milligram per day? 1.8. For the treatment of Kala Azar, the daily dose of miltefosine in a 3-year-old child who weighs 15 kg is 30 mg. The single most sensitive tool for evaluating the iron status in an individual is serum ferritin value. Which of the following criteria must be met by a disease before it is to be considered suitable for a screening program? The natural history of the disease should be adequately understood. There should be a test that can detect the disease prior to onset of signs and symptoms. As a part of the universal immunization program in India, the inactivated polio vaccine IPV, given as fractional IPV by intradermal route, is administered at what age? 6 weeks, 14 weeks. Intravenous tubes, catheters, gloves. The above mentioned biomedical waste will be segregated in red bag as per the Biomedical Waste Management Rules 2016. Which of the following parameters are required for calculating the Human Development Index? Life expectancy at birth, gross national income per capita, mean years of schooling. Which of the following statements regarding the open vial policy 2015 are correct? It applies only for DPT, TT, hepatitis B, OPV and liquid pentavalent vaccine. Vaccine vials opened in session site can be used again provided a vaccine vial monitor has not reached the discard point. Open vial should never be submerged in water. Which of the following statements are correct in respect to hemophilia? It is a hereditary bleeding disorder. It affects females occasionally and mildly. To prevent neonatal tetanus in an infant born to a woman who was not being given tetanus toxoid TT appropriately during pregnancy, what should ideally be done? Injection antitoxin serum ATS has to be administered with 6 hours of birth. What is the shelf life of Dukoral WCRBS oral vaccine used for cholera prevention when stored at a temperature of 2 degree to 8 degrees Celsius? 3 years. Which of the following are correct in respect to the incidence rate? It refers to a specified period of time. It refers to a defined population. It must include the unit of time in final expression. 40 patients with diarrheal diseases were studied. Their age distribution is given in the table below. The mean age of the patients in this study, 5 years. Which one of the following international agencies focuses on the country health programming approach? The United Nations Children's Fund, UNICEF. Which of the following statements are true about End TB strategy? The strategy goes beyond patient care to promote TB prevention. The targets are to be achieved by 2035. The strategy identifies 4 barriers to achieve progress in the fight against TB. Which one of the following is the commonest extrasalivary gland manifestation of mumps in adults? Orchitis. All cases of severe measles and all cases of measles in areas with high case fatality rate need to be treated with which of the following vitamins? Vitamin A. Consider the protein content of the following food items in terms of grams per 100 grams of food. Which is the correct descending order, highest to lowest of protein content? Soybean, meat, cow milk, sugar. Which of the following are modifiable risk factors for coronary heart disease? Cigarette smoking, obesity, sedentary habits. Determination of alpha fetoprotein levels in maternal serum is a useful screening tool for neural tube defects. Consider the phases of a family life cycle. Correct order of the phases, first to last: formation, extension, contraction, dissolution. Which of the following services are provided to pregnant women under the Integrated Child Development Scheme ICDS? Health checkup, immunization against tetanus, supplementary nutrition, nutrition and health education. Which of the following are the principal cause of infant mortality in India? Acute respiratory infection, congenital anomalies, diarrheal diseases. Throughout history, humans have been adapting environment to the genes more than adapting genes to the environment. Adapting environment to the genes is called eugenics. In a town, a study was carried out to determine the role of cigarette smoking in causation of lung cancer. It was found that a total of 7,000 people in the town were smokers. Of them, 70 developed lung cancer. In the same town, 3,000 people were non-smokers. Of them, 3 developed lung cancer. Given these numbers, what would be the attributable risk to cigarette smoking for lung cancer? 90%. A town in the hills have a mid-year population 250,000 in the year 2001. During the same year, the death registry of the town recorded 1500 deaths due to tuberculosis in 365 calendar days. Given these facts, what is the specific death rate for tuberculosis in the town? 6. Which of the following rare vaccine reactions are known to occur with BCG vaccine? Suppurative lymphadenitis, osteitis, disseminated infection. Which one of the following vaccine is known to interfere with the yellow fever vaccine if administered within 3 weeks of each other? Cholera vaccine. Regarding the Vande Mataram scheme, consider the following statements. It is a voluntary scheme wherein any obstetrician, maternity home, nursing home, MBBS doctor can provide safe motherhood services. The TT injections are provided by the district medical officer to the enrolled doctors for free administration to the beneficiaries. Consider the following measures which can help make unlined kacha wells sanitary. Deepening of the bottom, installing a hand pump with screen, construction of a platform and drainage once the material used for filling is completely consolidated. In which way is membrane filtration technique better than multiple tube method for determining the presence of coliform organism in water? Membrane filtration technique is much quicker and results can be obtained within 20 hours, while multiple tube method is much longer. Of the following amino acid required by the human body, which one falls under the category of essential amino acid? Threonine. Consider the following statements with reference to the National Framework for Malaria Elimination in India 2016-2030. The goal is to eliminate indigenous case throughout the country by 2030. By 2022, transmission of malaria is to be interrupted and indigenous case brought to zero in all 26 states and union territories that were under categories 1 and 2 in 2014. With reference to determinants of neonatal mortality, consider the following statements. Neonatal mortality is directly related to the birth weight of the newborn. Neonatal mortality is directly related to gestational age at which the birth takes place. Neonatal mortality is closely related to educational status of the mother. As per the definition of World Health Organization, late maternal death is defined as the death of a woman from direct or indirect obstetric causes after more than X days but less than 1 year after termination of pregnancy. Which one among the following is correct value of X? X equal to 42. In a newborn, the Apgar score has been recorded at 1 minute of birth. Doctor record the following observation. Heart rate 92 per minute, respiratory rate slow and irregular, muscle tone flaccid, reflex response no response, color body pink, extremity blue. Apgar score of this newborn infant 3. The following table shows some of the pneumoconiosis diseases along with the most implicated causative chemical agents. Which among the following represent the correct combination of diseases and causative chemical agents? Anthracosis, coal dust, bisonosis, cotton dust. The following table shows the total fertility rate TFR by the Wealth Index as per the National Family Health Survey NFHS 4. Findings are given below. Correct information is each of the higher division of the Wealth Index had lower TFR than the previous or lower division.